in orthodontics. Extraction in orthodontics regarded as the main part for space regaining procedure in orthodontic. Indication for extraction. In arch length to size discrepancy, the incisors either protruded forward or crowded in the small arch. So the incisor protrusion can compensate the potential crowding. So the incisor protrusion and the incisor crowding are two faces of one coin. And here the indication for extraction is relief of crowding, which are the moderate and severe crowding, and in the choice of the tooth to be extracted to relieve the crowding depend on the condition and the position of the teeth. Condition: when the teeth are badly carious or hypoplastic or root canal treated, are preferred for extraction to relieve the crowding. In addition, the malpots or severely malposed teeth that are difficult to align are preferred for extraction to relieve crowding. The position of the crowding when the teeth to be extracted should be as near as possible to the crowding area. For example, in the crowding in the anterior part of the teeth, we prefer the extraction of the premolar because the first premolar regard as near as possible to the crowding area. The other indication of extraction is the camouflage treatment or the treatment for correction of sagittal interarch relationship, and it's used in case of correction of mild to moderate class 2 and class 3 cases and class 1 cases. Here in the class 1 cases or class 1 malocclusion, it's preferable to extract in both arch because it is not advisable to discourage the development of only one arch more than another. While in class 2 cases with abnormal upper proclination with normal lower arch, here we prefer for the extraction of only in the upper arch, which is the first molar, first premolar. In the class 3 cases, it's preferable to the extraction in the lower arch. The extraction procedure in the orthodontic, either balancing and compensation extraction or enforced extraction, Wilkinson extraction, serial extraction, and therapeutic extraction. Compensation extraction, there is a difference between the balancing and compensation, where in the balancing extraction is defined as the removal of tooth on the opposite side of the same arch, to preserve the symmetry in the arch. Here we have, in this case, shifting in the midline to the left side of the patient due to the unbalancing extraction of the mandibular canine, deciduous canine, and leaving the deciduous canine on the other side. While in case of balancing extraction, in this case, the canine contralateral, the canine in the opposite side should be extracted to preserve the shifting in the midline. In the compensation extraction, we have to remove the equivalent tooth in the opposite arch. That means when you extract the mandibular primary second molar, you have to extract the maxillary primary second molar to maintain the buccal occlusion within the class 1 relationship. Here, due to the extraction only in the mandibular arch, cause drifting of the mandibular first molar forward and not maintain the buccal occlusion. But you have to keep in your mind the balancing and compensation extraction of other sound second primary molar. It is not necessary unless you have found a poor long-term prognosis. That means the tooth on the opposite side of the same arch in case of balancing extraction, or the opposite tooth in the other arch or the opposite arch extracted when you have a poor long-term prognosis. That means the other tooth either badly caries, need to the extraction period, etc. Enforced extraction means the extraction of the teeth that are unrestorable. For example, the grossly decayed teeth, poorly periodontal teeth, fractured teeth, and that teeth that are not restored by any means of restoration. The Wilkinson extraction means extraction of the four first permanent molar, which are highly susceptible to caries, and this to provide or maintain good class 1 buccal occlusion by the second molar and avoid third molar impaction. For example, in this case, you can see the badly carious maxillary first molar and the badly carious of the mandibular first molar on the other side. So Wilkinson advocate the extraction of the four permanent molar here before the tooth formation of the second molar, to provide good space for the third molar to erupt, and at the same time the second molar maintain the buccal class 1 molar relationship. Therapeutic extraction include the extraction that carried out for the orthodontic purpose. The orthodontic purpose, as mentioned before, either relief of crowding or correction of the sagittal relationship, as in case of class 1 or class 2 or class 3 malocclusion. The permanent teeth that should be extracted for therapeutic extraction, either the permanent incisors, canine, permanent premolars, and permanent molar. Mostly the incisors are extracted to relieve the crowding in the anterior area. And the extraction of the incisors either are indicated in case of the poorly prognosis, as in case of traumatized incisors, badly carious incisors, poor low bone support for the incisors, root resorption of the incisors, as in this case the severely root resorption of the incisor due to the effect of the erupting maxillary canine. Other indication of the extraction in the incisor is the correction of mild class 3 cases, as in this case there is a mild class 3 with mild crowding in the mandibular arch and corrected by extraction of one of the incisors. When the incisors are buccally or lingually blocked out, we can extract one of the incisors to relieve buccally or lingually blocked out lateral incisor. Here you have the lateral incisor, which is lingually out of arch, and the extraction of this lateral incisor crowding. But the disadvantage of this extraction is the intercanine width will be decreased, and the decreasing of the intercanine width of the mandibular arch will cause intercanine width of the maxillary arch on in the anterior region and cause secondary crowding of the maxillary arch. So, of one of the lateral incisor which are blocked out lingually or buccally, the canine should be distally inclined. When the canine is medially inclined or buccally inclined or upright, in this case the extraction of the one of the lateral incisor it is not advisable. For the extraction of the canine for relief of crowding, in case of maxillary canine, the canine extracted when they are impacted or ectopic, as in this case, the canine is impacted and difficult or impossible to align. In addition, the occlusion with the presence of the first and second molar instead of the position of the canine is acceptable functionally and aesthetically. For the mandibular canine, extracted when the apex of the canine is severely malposed out of the arch and is difficult to align. The first premolar are indicated for extraction to relieve the crowding or to correct the sagittal relationship, and it is regarded as the tooth of choice for extraction in orthodontic because first it's near to the crowding site because it is positioned at the center of each quadrant of the arch, and at the same time it's the midpoint between the anterior teeth and the posterior teeth. In addition, the extraction of the first premolars here will maintain the vertical dimension of the arch and maintain the molar relationship here. The extraction of the first molar will provide a good contact between the canine and second premolar, and the presence of the second premolar with the molar provide a good anchorage for retraction of the anterior teeth. The second premolars are indicated in cases of open bite when there is a mild anterior crowding, because the extraction of the first molar in the mild anterior crowding may provide a space or leave a space after the treatment. So it's easier to extract the second premolar in mild anterior crowding and close the space by relieving of the crowding and protraction of the posterior teeth. In addition, we need to maintain the soft tissue profile and aesthetic and give good support for the lips by the anterior teeth in cases of mild crowding. The completely excluded from the arch or grossly carious second premolar or periodontally compromised second premolar or out of arch completely second premolar are also indicated for extraction for the purpose of orthodontic treatment. The extraction of the permanent first molar are rarely indicated because the extraction may deepening of the bite. In addition, there is a poor interproximal contact between the second premolar and second molar. The mastication may become insufficient after the extraction of the first molar. In addition, the inadequate space for relief of the anterior crowding in spite of the large tooth material of the first molar, because the first molar is far away from the position of the crowding. So the first molar are indicated when it is badly carious, periodontally poorly prognosis, or in rare cases when the first molar is impacted. The extraction of the permanent second molar are indicated in case of relief mild to moderate crowding by the molar distalization by extraction of the second molar, and at the same time distalization of the first molar either by headgear in the maxillary arch or lip bumper on the mandibular arch to preserve the facial profile of the patient. And in addition, when there is a crowding only in the buccal segment, and in this case you need for extraction of the second molar to relieve the crowding in the buccal segment. The extraction of the second molar also indicated when it is impacted against of the first molar to provide the space for the third molar to the position of the second molar. And in this case, the second molar is used to relieve the impaction of the third molar, which should be the long axis of the third molar in upright position or minimum medially tilted of about 30 degrees. And in addition, the extraction of the second molar should be only after the calcification of the third molar crown or just after the root formation of the third molar has started, which is usually between the 12 to 14 years old. And in this case, the extraction of the second molar will ease the eruption or facilitate the eruption of the third molar and prevent the impaction of the third molar and easy uprightening of the first molar. The extraction of the second molar also used in cases of open bite posteriorly, because the extraction of the second molar posteriorly will improve the correction anterior open bite.